My name's Matt Carter. I'm a Relationship and Development Director for South Central and West. A whole load of things within that account management role, including making sure that our performance of our delivery is up to scratch and making sure that if there's any issues, they're dealt with quickly, and building relationships with lots of new people across those ICSs to make sure that where we can support the systems with the challenges they have, we match them to our capabilities and do what we can to support them. I joined South Central and West in 2015, straight off the back of a 16-year career in the Air Force, the Royal Air Force. There I was in the Royal Air Force Regiment, which was an infantry background, and left as a wing commander, having done sort of a different job every 2 years in the Air Force. No experience in the NHS at all, but wanted to continue to be serving and wanted to work close to home, having done 4 tours of Afghanistan. So wanted to make sure that, I found a job that was still suited to, the way I thought about the world in terms of wanting to provide service. I initially joined as a contract manager. Every single advert in the NHS seems to want NHS experience, but thankfully someone saw through that with me and gave me an opportunity. And I've really moved quite quickly from contract management into managing our accounts and becoming an account manager, and I've done that for the last 5 years and sort of extended, starting with my career in management in Sussex and then extending to sort of 4 bigger accounts or wider accounts across the southeast. So I joined South Central and West in 2015, so I've been with us for about 7 years, coming up 8 years. And I previously had done a career in the Air Force for 16 years. There's a lot of transitional skills that came across from the Air Force as an officer that have really helped me in my career in South Central and West, especially building relationships with people. I think there's lots of challenges within the Air Force of getting people to do what you need them to do in really high risk environments, and that experience has been really helpful. Working with people and lots of different people and building new relationships. We're very lucky. We get a chance to see lots of challenges and lots of different parts of the health and care services which you don't necessarily get when you're working in a hospital or working in primary care. So we get a really wide view of all the challenges and understanding how we can support them. Of course, it always feels better when you're supporting directly patients and outputs towards patients, but we provide a lot of services that support all the way across the spectrum of what health and care does. I think it's a really great place to work. First of all, South Central and West will look after us really well, so they're very, very focused on looking after the people. Also focused on our role across health and care, which is to really make improvements and support the systems that we work with to support their populations. So from a service background and wanting to provide and continue that service, I think South Central West is a really good way of allowing people to do that aren't potentially clinical in their nature or haven't got experience of working in hospitals. So we bring in lots of experience from outside the NHS across health and care and put that experience to good use for health and care. And I think that's what South Central West does really well. To focus on where you're making a difference. And there are lots of frustrations in working for a big organisation, and things don't always move as fast as you would want them to. But you can make a really big difference to populations and to people and to health and care across the spectrum. So keep focused and don't take no for an answer. There's a load of really good people that really want to do the right thing. With the right leadership and the right teamwork, then you can make amazing things happen. You don't have to be in a physical office location. You can work from home or you can work from wherever you need to be and still have a really big impact. I think that the second thing would be our depth and our breadth. We do a huge amount, and there's always something that's going to be interesting for anyone, whether it be the types of services we provide from an analytics or BI, business intelligence type perspective, or finance or clinical, or there's something that everyone could get their teeth into and make a difference in. I think lastly it would be the the fact that whilst we're working through a number of different agencies to support them, the benefits can still be seen, no matter what you're doing, to the patients and to the populations that are being served, and that's the key driver. I think when I first joined, we had quite a transactional relationship with one of our customers, and we had to work through a lot of issues in the quality and service of our delivery and the expectation of the customer, and we moved that relationship from being very transactional to being what is now a really strong partnership, and we're providing what I think is a great service embedded with the customer. The customer is getting more than they were getting previously in a transactional relationship, and we are developing and evolving our services as they change as a customer, and that for me is really strong. That's where our partnership approach pays dividends both to ourselves and to our customers and the populations we serve, because everything is more seamless and everyone concentrates on the solutions rather than points fingers when there's problems. Well, I think our graduate scheme is absolutely fantastic. There's an opportunity to see all the different parts of our organisation. I've been a mentor to a graduate for 2 years, and they've done incredibly well, and we've probably spoken every other month or something like that for an hour or so, and it just gives them a great opportunity to ask questions that they wouldn't want to ask to their line management, and I'll give them a really honest answer to things that they might not otherwise get. And I really enjoyed doing that, and have now started mentoring someone on the new grad scheme. And everyone I speak to on our grad scheme seems of amazingly high quality and are really intelligent and doing really well, and actually really enjoying the different parts of the organisation that they're working with. I've not spoken to anyone that hasn't enjoyed what they're doing. Which bodes really well, but also I've been hugely impressed with the quality of the people we've had on our grad scheme. I'm Matt Carter, I'm a Relationship and Development Director. This is life at SCW.